Okay, let's start right back up again. My name is Heidi Christensen. I'm with the Center for Faith-Based and Neighborhood Partnerships at the U.S. Department of Health and Human Services. I want to truly thank the National Academies of Sciences and the Roundtable, each and every one of you, on population health for hosting this important and timely conversation, and for recognizing the significant and particular contribution of faith communities, organizations, or just people inspired by faith or a deep calling to improve the health outcomes of their members and their communities. The Center for Faith-Based and Neighborhood Partnerships, or the Partnerships Center, is in the Office of the Secretary in Washington, and our primary mission is to strengthen the response of faith and community organizations in response to public health issues, public health crises. And of course, one of those crises currently that we're very much focused on is the opioid epidemic. And you may have seen that the administration announced this week the initiative to stop opioid abuse. And it aims to address many factors fueling the opioid crisis, including overprescription, illicit drug supplies, insufficient access to evidence-based treatment, and recovery support services. But we also recognize that at its root, the opioid epidemic is a crisis of hope. And we know that a critical and particular asset of people of faith and their communities and organizations is a shared narrative of hope, of belonging, of community, potent prescriptions when it comes to the behavior change necessary to manage chronic conditions. And they also have a history, and they have the experience in providing the wraparound services that actually restore and rebuild lives, bringing hope and healing to our neighbors in need.